Hello everyone, this is Dr. Garima Sachdeva and today I'll be discussing about long-term consequences of PCOS and the ways of screening them. So the first risk is of GD. So as compared to the general population, in PCOS females there is 2 times higher risk of developing gestational diabetes mellitus or diabetes in pregnancy. And how do you screen them? You do an OGTT test at 24 to 28 weeks of pregnancy. Then type 2 diabetes mellitus. So PCOS females are at a risk of insulin resistance and this risk is seen in 65 to 80% of those females. So you offer them OGTT, especially if PCOS females were overweight with BMI more than equal to 25 or who have additional risk factors such as advanced age, personal history of diabetes or family history of type 2 diabetes. And in case any of the E-para fasting blood sugars or HbA1c you find it is deranged or there is impaired glucose tolerance, then you repeat OGTT on annual basis. The third risk is of obstructive sleep apnea. So this risk is 30 times higher and it is especially seen in obese PCOS females. So when a PCOS patient comes to you, you should take history of snoring or daytime fatigue or somnolence. Then psychological issues are very common in PCOS females like depression and anxiety and they should be screened for and addressed. Then cardiovascular diseases. So PCOS females are at 3 to 6 times higher risk of developing CVS diseases, especially those who have risk factors. So risk factors like obesity, lack of physical activity, cigarette smoking, family history of type 2 diabetes mellitus, dyslipidemia, hypertension, impaired glucose tolerance, type 2 diabetes mellitus should be screened. Then endometrial hyperplasia and cancer. So there is 3.89 times higher risk of endometrial hyperplasia or cancer. So you should screen patients for oligo or amenorrhea, and if the periods are delayed by 3 to 4 months, it is a good practice to give them progesterone withdrawal. You should screen these females for this endometrial hyperplasia and cancer in cases of heavy bleeding or when you have a doubt of it using transvaginal scan, and a thickened endometrium or an endometrium polyp should prompt the consideration of doing a biopsy or a hysteroscopy. However, there is no increased risk of breast cancer or ovarian cancer, so no additional surveillance is required for them. So that was all for today. Thank you so much.